So unlike hockey or basketball season, this is the start of a campaign nobody really looks forward to. Yep, it's flu season, and last year it took quite a toll. More than 300 deaths in Canada were directly attributed to influenza, as well as 64,000 lab-confirmed cases. The season peaked in mid-February. Now, one factor that can affect the impact of the flu is the vaccine developed to counter it. And while this year's version looks promising, according to experts, each season presents new challenges to health officials who create the vaccine. And Dr. Isaac Bogosh is an infectious disease specialist at Toronto General Hospital, and he joins me now. Thank you for being with us.
Thanks for having me today.
So first, let's start with this year's vaccine. Why is it that health experts are saying it looks like it might be a better match to counter the strains that are out there this year?
Well, what happens is the several organizations, including the World Health Organization, get together and they look at the circulating strains of influenza virus, and they try to predict what those strains are going to be when they hit the Northern Hemisphere. And then what they try to do is they try to match the vaccine to match those circulating strains. And it looks like this year's match is going to be pretty good.
And I guess for the most part, though, it is a prediction because really you won't know until it is tried and tested. So how do the powers that be really predict whether or not these will be more effective than, for example, they were last year? And I know the numbers that came out, and this is because of or due to the Canadian Sentinel Practitioners Surveillance Network of researchers, and they said that it was only 17% effective in preventing respiratory illnesses from the dominant strain of influenza, which doesn't sound very effective. So how do you decide whether or not this is actually going to work?
Yeah, it's, so I think you hit the nail on the head there. This is really an imperfect science, and there's a lot of, a bit of guesswork that goes into it, a bit of predicting, and a lot of modeling that goes into it. But in addition to that, there is still a lot of, good science that goes into it as well. One of the issues is that the influenza virus can mutate along the way. So even the best predictions might be a little off, because even if you get the right strain and you develop the right vaccine for the right strains of virus that are coming through that year, the virus can sometimes mutate even midway through the influenza season. So even if you got it bang on and got the right vaccine for the right virus, the virus is constantly changing. And it's very challenging to keep up with the changing virus. So that's why sometimes it's not perfect. The other issue was last year, believe it or not, the prediction for the circulating strains was actually rather accurate. And one of the reasons why the vaccine wasn't so effective was because in the manufacturing process of the vaccine, there might have been a subtle change to the protectiveness, essentially, of the vaccine. And that happened during the manufacturing process. So even though the strains were accurately predicted, the vaccine that was created wasn't the most effective vaccine. However, it looks like this year is going to be a lot different, and it looks like this year the vaccine will have a much better rate of protection.
And now when you say that the virus is constantly mutating, how can one tell whether or not it's mutating to be more severe or more mild? And what sort of impact does that have on whether or not these vaccines work?
Well, I mean, sometimes mutations don't make the virus any more severe. Sometimes it doesn't make it any more mild. It just makes it different, and it's a constantly changing virus, and it makes it challenging for scientists and public health officials to really keep up, because it's hard to stay one step ahead of the virus. I think the key point here is, regardless of how perfect or imperfect the influenza vaccine is, the point is that it's still the best form of protection that we have. And, healthcare professionals and public health professionals realize that it's not a perfect vaccine, but it's still the best we've got for now. And, when we look at people that do unwell, when people get sick from influenza, remember, influenza, very severe illness. This kills over 500,000 people per year. Like, this is a bad virus. And when we look at people who have the ultimate fatal outcome, people who die from influenza virus, there's a disproportionate number of people who have not been vaccinated compared to those who were vaccinated. So we still know that the vaccine does help.
No question, those numbers that you're citing certainly are more severe than I would expect most people believe the flu to be. So in terms of whether or not it's more mild or more severe, your advice would be that people should still get the vaccine no matter what that sort of coverage shows, whether it is, again, more mild or more severe of a strain. Is there a right time or a best time to get the vaccine?
Yeah, the sooner the better. It often takes a couple of weeks for your body to develop the right chemicals. They're called antibodies. And it takes a little bit of time for someone's body to really adjust and to really provide that protection against the circulating influenza virus once they've received the vaccine. So when the vaccine campaigns start, which is around now in most places, this is the best time to start to get the vaccine. One other quick point too is when we talk about perhaps this season being a milder season, we're talking on a population level, and we're talking about probably less severe cases, meaning fewer hospital admissions and fewer deaths. And hopefully that's the case compared to what we saw last year. But that's at a population level. We have to also think about an individual level. You know, bad things can happen, and people can get very sick. This is not a little sniffle. This is not a little cough and cold. This is influenza. And often people think that they have a little cough and cold. They say, "Oh, I had the flu." That's not the flu. That's an upper respiratory tract infection, usually another type of infection. Influenza is a very serious virus. And although the vaccine isn't perfect, it's still the best we've got, and people should do this to protect themselves and also to protect those around them.
All right. Well, thank you for the tips and for joining us today, Dr. Isaac Bogosh.
Thanks for having me.
And Dr. Bogosh is an infectious disease specialist at Toronto General Hospital.